Now to the rebound, Milwaukee, and making ends meet. If you have not made a trip yet to the pharmacy in this new year and you don't have insurance, you could be in for a sticker shock.
A lot of brand name medications are costing more this year. Our consumer investigator Kristen Byrne shares a few ways that you can still save.
Healthcare company GoodRx tracks prescription drug costs. And so far this month, the company is reporting 735 drugs have gone up in price.
The company reports it's typical to see drug prices jump in January and July. On the long list is asthma steroid, Qvar, antidepressant Lexapro, and Humira, a medication for rheumatoid arthritis.
Brand name medications every year increase between 8 to 9.9%.
Hyatt pharmacist Dr. Hashim Zabak isn't surprised to see drug prices up.
Do you think they're increasing more so because of COVID-19?
Obviously, COVID-19 impacted the supply chain, the international supply chain. Sometimes when a raw material is hard to get, you'll see an increase in some of the manufacturers would increase their pricing.
If you have insurance, you're likely not going to pay the list price of a medication. But if you are uninsured, medication can get costly.
The one thing that they can do to improve on the cost of the medication is communicate with the pharmacists. Sometimes one medication might cost $300-400, but there's another medication within the same class that costs only $10.
Another suggestion Dr. Zabak has is to ask your pharmacist about manufacturer coupons.
So sometimes certain manufacturers will have coupons, so they come to us, we'll help them go through the challenges of finding the right coupon. And that's not easy. Sometimes it can be a challenge.
Another idea, if your medication costs too much monthly, to cut down on the price, see if you can get a one-year supply. Dr. Zabak says this only works for people who've been on the same dose of a drug for a long period of time. For example, he recently helped out a customer taking a prescription for Parkinson's.
And I told him, why don't you get a one-year supply? And so the doctor wrote him a prescription for a one-year supply, and it costed him significantly less per month than GoodRx or any other option.
Here's your rebound rundown. If your medication price went up this year, ask your pharmacist if you can take a different medication in the same drug class. Also, ask about manufacturer coupons and whether getting a one-year supply would work for you. For the Rebound Milwaukee, I'm Kristen Byrne.